Hi class, my name is Zena Dromov and I'm going to be discussing here in this video blog the counselor credentialing for the state of California, which is where I currently live and am a resident of. So before I get into our sheet that we had to obtain all the information for, I did have to go to two different websites to get all of my information. One was the Board of Behavioral Science, and I looked at the licensing requirements for California there. And the second website that I had to use was the Board of Psychology, yes. And I also looked up the requirements for California there. So, as I mentioned earlier, the state that I am requesting information for is for California. And so some of the academic and training requirements include obtaining and qualifying master's degree with no less than 12 semester or 18 quarter units of coursework in theories, principles, and methods of a variety of psychotherapeutic orientations directly related to marriage and family therapy and marital and family systems approaches to treatment and how these theories can be applied therapeutically with individuals, couples, families, adults, including elder adults, children, adolescents, and groups to improve, restore, or maintain healthy relationships. Also, a minimum of 6 semester or 9 quarter units of practicum in a supervised clinical placement that provides supervised fieldwork experience. So the next question, which is, what are requirements for the postmaster's supervised clinical experience? For the state of California, it's 3,000 total supervised hours, over 104 weeks at a minimum, and also a minimum of 150 hours of face-to-face experience with counseling individuals, couples, families, or groups. And also, you must register as an associate marriage and family therapist. So some of the examinations that are required for the state of California is the California Law and Ethics exam and the Licensed Marriage and Family Therapist Clinical exam. So the title for this license in California is the LMFT, or the Licensed Marriage and Family Therapist. And so I did see that there is a tier, and I looked that up, and it was the Licensed Professional Clinical Counselor, also known as the LPCC. And you also must register as an Associate Professional Clinical Counselor. And other titles and requirements include the live scan, the background check, and passing both the exams that I mentioned earlier. So the scope of practice, some of the things that can and cannot be done, being a LMFT for California, is California psychologists cannot legally prescribe medication. They may, however, discuss medications and suggest a physician and discuss collegially with the physician about the patient to ensure appropriate overall treatment, and they are to monitor the patient's progress with psychotherapy. And then if there were any other miscellaneous requirements, I think I mentioned them earlier too, but it was just criminal background, live scan, and electronic transcripts. So one of the things that I feel like kind of surprised me when I was looking up everything that was required for California was the amount of hours. I thought that it was a lot. I didn't think it would be so many, honestly. And I think it may be a challenge because that's a lot of hours. But I think as long as I get with a mentor of such and have a good supervisor that can help me kind of plan that schedule, as you know, being a beginner after I graduate, I think it'll be fine. But I have to be honest, I do feel like it's a little intimidating to say the least. So that was one of the main things that I thought would maybe be a challenge.